If you are also suffering from repeated IVF failures, repeated pregnancy losses, then this video is for you. Myself, Dr. Sneha S, fertility specialist and gynecologist at NU Fertility, Rajajinagar. In the next few minutes, I am going to walk you through the procedure of IVF and then IVF cost, what is the failure rate, what is the success rate, in a simple language that one can understand. I know the parenthood journey is very exhausting, and with every negative result, your stress levels increases. You are not alone. We are there for you at every point with compassionate care, and we handhold you with our expert guidance. Let me begin with what is IVF. IVF stands for in vitro fertilization. Here, a woman is given hormonal injections from second day of the periods to retrieve the eggs on a particular day, and then once the eggs are retrieved, these eggs are mixed with husband's sperm and they are fertilized in the laboratory, and these embryos, once they are fertilized, they are transferred to woman's womb. This is called in vitro fertilization, or in layman's terminology it is also called as test tube baby. One may ask, is IVF recommended for all patients, doctor? No. IVF is recommended for certain category of patients. The first one being blocked fallopian tubes or damaged fallopian tubes. The second category will be low ovarian reserve. The third reason being if the sperm abnormalities are very severe. Say for example, the count may be very low, or the morphology can be very less, or the motility can be very less. Next reason being advanced form of endometriosis, where the egg quality will be very much reduced. The next category will be for fertility preservation. If you are a working woman, you don't want to plan your pregnancy currently, but you want it to be placed at a later stage, then you can opt for fertility preservation through IVF. Next category will be if you are an elderly couple looking to get pregnant, then IVF is the better solution for you. If you have repeated pregnancy losses or abortions, if you are considering genetic testing, then also IVF is suggested. Let's break down the procedure of IVF in a step-by-step manner. First is patient preparedness. So as soon as couple comes, we do certain examination and make sure that the woman and husband both are fit to begin the fertility journey. We evaluate the couple, we examine them, and then order certain hormonal assays, ultrasound examination and semen analysis. If any medical disorders are there, those medical disorders require attention. Particular medications are to be started, and the particular medical condition have to be treated before embarking on fertility journey. It is not only the physical fitness, the mental fitness and emotional fitness of the couple also is very important before embarking on the fertility journey. The second procedure being ovarian stimulation. On the second day of the periods, a woman starts with the hormonal injections. Usually these hormonal injections are to be taken usually on the same time of the day for nearly 8 to 12 days. Once the hormonal stimulation has begun, after roughly about 8 to 12 days, the woman undergoes egg retrieval procedure. This egg retrieval procedure is a very simple procedure. It lasts for about 15 to 20 minutes. It is done under IV sedation or a short general anesthetic. Lot of you are very apprehensive about egg retrieval procedure being very painful. No, it is not. It is not a painful procedure. It is done under a proper sedative or a general anesthetic. So it is really painless. On the day of the egg retrieval, all the oocytes are retrieved from the vaginal root. In the IVF lab, these eggs are fertilized with husband's sperm by a qualified embryologist, and they are allowed to grow for 3 to 5 days. So once the embryos have reached the stage of day 5 or day 3, these embryos are either transferred in the same OPO cycle or they are frozen and will be used for embryo transfer in the subsequent cycles. This egg retrieval procedure is a daycare procedure. Usually woman goes home on the same day of the procedure. So how is embryo transfer done? Embryo transfer is a painless procedure. It takes about 1 to 2 minutes. It is done, the embryo 1 or 2 good quality embryos are transferred through very fine thin catheter. You don't need anesthesia for embryo transfer. You don't need any painkillers for the embryo transfer. After the embryos are transferred, after 2 weeks, you can expect pregnancy results through blood test. So if the pregnancy test comes positive, hey there, you're pregnant, then pregnancy medications are started and the woman is examined as a pregnant woman. If the pregnancy test is negative, we call the couple, then we evaluate what went wrong, what is the reason for negative pregnancy, and then we order certain tests and we discuss with the embryologist, we discuss with the andrologist and make a plan before doing the next subsequent treatment plan. Here are the few frequently asked questions asked by the couple who visit us. First frequently asked question is IVF painful? Not at all. IVF is not painful. Usually IVF injections are not painful. The egg retrieval procedure is done under short anesthetic or a sedative. So generally it is painless and women do not require prolonged admission in the hospital. Woman goes home on the same day. It is done as a daycare procedure. How long does one IVF cycle takes? Usually IVF cycle takes about 4 to 6 weeks. If the pregnancy test comes positive, then no more need of embryo transfer is required. If the pregnancy test comes negative, then subsequent cycle has to be planned accordingly. What is the success rate of IVF? As per the international standards, the IVF success rate is around 40 to 60%. Again, the success depends upon the age of the couple, what are the risk factors, what is the diagnosis of both husband and wife, and how is the ovarian reserve, and any other complicating factors are there. So at our NU Fertility, our success rate has been consistently maintained at 60%. Next frequently asked question and most googled question is what is the cost of IVF? The cost depends upon the IVF procedure per se, what are the injections used, how many days of injections are necessary, what are the other advanced medical risk factors are there, what are the other complicating factors that are there, what are the additional advanced techniques that are required, what are the other genetic assessments or any other facility is required. So the combined profile and the combined treatment modalities will decide the cost of the IVF cycle. So the cost of IVF varies on several factors which I have already briefed. Before beginning the IVF journey, the entire cost will be told to you transparently and you can decide and begin your fertility journey. What are the risks of IVF? So the IVF, which is terminology itself is so apprehensive, is not at all risky. Apart from mild side effects like bloating, nausea, then vomiting sensation, then slight weight gain, there are no major risk factors. The very severe risks like ovarian hyperstimulation syndrome, torsion, they are all very rare. So if the cycle is monitored correctly, if the dose of the IVF injection is given properly, then one shouldn't expect any major side effects. This is where the IVF cycle goes wrong if it is not monitored properly. If you are considering IVF cycle but confused about IVF cycle, then you are not alone. Save this video and if you have any questions, comment below.